Opposition spokesperson, Preet Gill.
Ms McDonough, it's a pleasure to serve under your chairship on this debate responding to the e-petition 614335 on pandemic prevention, preparedness and response. I want to thank the honourable members from across all sides of the House for their contributions this afternoon, and I'm glad this debate has been conducted in a mostly measured and thoughtful way. The COVID pandemic has been one of the most surreal and seismic global events of our lifetimes. 212,000 people have died as a result in the United Kingdom, and our economy has been directly hit to the tune of 250 billion of lost GVA. And the social impacts on everything from our children's lost learning to NHS waiting lists will be felt for many years to come. The extent of the damage the pandemic caused was not inevitable. The UK was badly unprepared. NHS waiting lists were at record levels even before the pandemic hit, and we had 100,000 staff shortages in our health service, 112,000 vacancies in social care. In 2016, the outcome of exercise sickness informed the government that the NHS would not be able to cope with a flu pandemic, and yet they still reduced the stock of PPE and the number of beds. Too many people have paid for that decision with their lives, particularly in care homes across our country, as untested patients were ferried from hospitals to homes. And then, of course, the billions of public money that has been wasted on unusable PPE, their chaotic shuffling in and out of lockdowns from a government that couldn't get a grip. And at the end of it, the UK's abject position as a worst-hit economy in the G7. After 12 years of Tory complacency, the next Labour government will never leave our country with such a soft underbelly. The next Labour government will deliver a new 10-year plan for the NHS, including one of the biggest expansions of the NHS workforce in history, doubling the number of medical school places to 15,000 a year, training more GPs, more nurses, more health visitors each year, and harnessing life sciences and technology to reduce preventable illness. While it might feel like the pandemic is over here now, the threat is not, and that is what today's debate is about. Far from a once-in-100-years event, many natural biological threats have emerged in recent years, including SARS, avian flu, MERS, Ebola and monkeypox. Climate change and globalization mean that natural biological threats are becoming much more common. And it is not only biological threats that we must prepare for. Advances in gene editing mean virologists can more easily modify viruses to be more deadlier and spread more quickly, increasing the security risk posed by bioweapons and bioterrorism. On this, I wonder if the Minister might comment on our concern that the Biological Weapons Convention currently remains very weak, with little funding and only 4 staff compared to the 500 staff of the Chemical Weapons Convention. Ms McDonough, pandemic preparedness must therefore be taken seriously as a matter of national security. Future threats could be far deadlier than COVID-19. During the first wave of coronavirus, 1% of infected individuals died, compared to 80% during the West African Ebola epidemic. The lesson of the pandemic was that no one is safe until everyone is safe, that global health is local health. So it is clear that global cooperation on pandemic preparedness and biological threats needs to be strengthened. It is why on this side of the House we absolutely support the principle of a legally binding WHO treaty which sets the standard for all countries to contribute to global health security. Our country was set back not just once, but 3 times by new dangerous COVID variants which had originated overseas. We are stronger together than trying to firefight these crises alone. The WHO is the primary UN agency for international public health, and in its history of over 70 years, it has contributed to the eradication of smallpox. It has helped immunize millions of children against preventable diseases such as tuberculosis, measles, and it is, of course, it's supporting the near eradication of wild polio. Currently, the WHO is responding to 55 graded emergencies around the world. Last year, it supported member states in response to over 75 different health emergencies, and over 339 million people are now in need of direct humanitarian assistance. And within those countries affected by fragility and conflict, we're seeing 80% of the world's major epidemics. The principles laid out in the zero text of the pandemic preparedness is a strong foundation from which to begin to tackle some of these crises. Its text on strengthening global health systems and universal health coverage, on international transparency and the sharing of technology, of diagnostics, vaccines and know-how, echo what we have said consistently on this side of the House during the pandemic. It is through multilateral efforts, strengthened through international law, that we can ensure that the response to the next pandemic is faster, it's more effective, and it doesn't leave other countries behind. Now, I know that the member for North West Leicestershire has been calling for this debate for some time and has reservations about this. I think it's really important that we do have this debate and show that there is no shadowy conspiracy here. I am afraid it is much more mundane than that. I note his claims that a treaty will, and I quote him, hand over powers to an unelected supranational body, even despite the fact that it would still have to be ratified by the United Kingdom, and there is over a year of negotiations to go. I would point out to him the very first statement in the zero draft text, which reaffirms, and I quote, the principle of sovereignty of states parties. Moreover, that the implementations of the regulations, I quote, shall be with the full respect for the dignity, for the human rights and the fundamental freedoms of persons. There are, of course, no references to vaccine mandates or lockdowns or any such draconian policies in the draft text. If he reads it, the draft treaty is primarily about transparency, fostering international cooperation and strengthening global health systems. So in recognition of the catastrophic impact of the pandemic on developing countries, it is therefore on the face of the text. So there are going to be negotiations. I will give way.
I'm very busy. Has she taken the point that there's a difference between Article 21 and Article 19? Why is she supporting Article 19 as the means of introducing this measure rather than the more flexible Article 21?
I've already set out, I thank the Honourable Member for his intervention, but I have set out the reasons that I am supporting this, and I'm going to further make those, that case a little bit further, and he will understand why we are supporting, on this side of the House, the treaty as it stands. And of course, there is negotiation, and I keep saying this, we've got to ratify this in the United Kingdom. There is another year to go to be able to contribute and feed into this. So I think, you know, his comments really need to be directed at the Minister. And as I said, the negotiations operating on the principle that nothing is agreed until everything is agreed, and that's a really important principle to hold on to. So in over a year's time, there's going to be 2/3 vote of WHO members, and then ultimately it's going to be for us to ratify and enact those policies as we interpret them. And I think this is really important that we recognise this. I would say that far from being a conspiracy, this process is actually the very basis for international cooperation, which is essential to tackling transnational threats. And as a country, we have a proud history of supporting the international system, using our influence and our expertise to set some of those common standards and bring parties together to achieve more than what they can do alone. So if we can use the World Health Organization to support basic universal health care around the world, then infectious diseases are less likely to spread and fuel global pandemics. Of course, that is in our national interest too. Ms McDonough, as I have said, pandemic preparedness is a matter of national security. Last year in a debate on global vaccine access, I warned that striving for vaccine equity, it wasn't only a moral imperative, but a matter of national interest. Yet those lessons have not yet translated into action. Today, just 27% of people in low-income countries have received a first dose of a COVID vaccine, demonstrating the terrible divide in coverage between richer countries and the global south. This government has paid homage to the need to address this in words and announcements, but in truth, their record has been dire. A damaging departmental merger between DFID and the FCO at the height of a global crisis, repeated aid cuts to the very programmes designed to keep us and others safe, promise to poorer countries made and then consistently not kept, and nobody expected the UK to retreat from the world stage at a time like that, to vandalise its own relationships, expertise and capacity. But the message it sent out to our partners and allies has been received loud and clear. They know who they can trust to show up in an international crisis and who they cannot. The irony is that those decisions harmed us as much as anyone. Vital research programmes to track new COVID variants were slashed by 70%, pulling the plug on many programmes mid-project, causing years of research to go to waste. Programmes to treat tropical diseases were cut by a shocking 95%, leaving millions of people vulnerable to these diseases and risking the wastage of over 270 million doses of life-saving drugs. The UK's contribution to the global polio eradication initiative was cut by 95% for at least 5 years. Then last summer, polio resurfaced in the United Kingdom for the first time in 40 years. Now, as our government diverts the development budget to prop up its failing asylum system, 8 of South Sudan's 10 state-run hospitals has lost their funding this month, putting them on the brink of collapse. So can the Minister explain what assessment she's made of the impact of that decision? Can she say when the refreshed global health framework will be published and how it will draw lessons from the last 3 years? The divide exposed by the pandemic was stark at a time when millions in the global south were in greatest need. The international system failed them. The government's charity model of aid did not share vaccines equitably or effectively, leaving millions unprotected and the poorest countries paying the highest price. And the UK's own promises illustrate the point. At the G7 in 2021, the former Prime Minister, the Right Honourable Member for Uxbridge and South Ruislip, promised to donate 100 million surplus vaccine doses within a year. A year later, barely a third were delivered. The aid budget was raided to do it, and the UK effectively profiteered at poor countries' expense. Earlier this month, provisional spending figures for 2022 were revealed, and a further 225 million was charged against the aid budget for vaccines that we had spare, making a total effective £330 million cut. I wonder if the Minister could provide a breakdown of the number of doses that were shared directly with developing countries and those that went through COVAX by make and pricing last year. How many of those doses were shared in total, and what steps did she take to minimise the cost to the aid budget, bearing in mind that these surplus doses would have been incinerated if they weren't used, and how many vaccines were priced at the maximum possible of $6.66. Ms McDonough, there is a different way, one which does not merely give people our crumbs from the table. Labour's new model for development will be based not on charity, but on solidarity and on long-term development planning. Our comprehensive plan to ramp up global vaccine manufacturing set out in 2021 is the blueprint for the change that we need to see. The pandemic revealed a fundamental problem, namely that the world has more capability to invent and develop vaccines than it has to manufacture and distribute them on a global scale. So while donating our surplus vaccine doses to poor countries was the right thing to do, in practice, it has been slow, it's been inefficient, and in this government's case, it's been used as a cover to make further stealth cuts to our aid budget at poor countries' expense. Developing countries should not have to wait for handouts at the back of the queue, and the next Labour government would strengthen global health systems using the NHS as a model, and we will help to establish an international mechanism to rapidly produce and distribute vaccines, share technology, knowledge and skills, and build the infrastructure that the world needs to deliver it. We need a global effort to develop viable, orally active vaccines in solid dose form, building on the innovative work carried out by a number of pharmaceutical companies. That would be a historic breakthrough, including the prospect of a vaccine delivery system which doesn't rely on needles and could lead to less need for trained vaccinators, increased take-up, and negates cold chain storage, meaning fewer doses would expire before they could be used. And finally, we need a binding, enforceable investment and trade agreement among all participating countries to govern the coordination of supplies and the financing of production, to prevent hoarding of materials and equipment, and to centrally manage the production and distribution process for maximum efficiency and output in the wake of a pandemic being declared. I'm pleased to see that this draft treaty offers a really strong starting point: technology transfer. Open sharing of vaccines, science, technology and knowledge through the TRIPS waiver would help ensure everyone can access vaccines, diagnostics and therapeutics, and that no one is left behind. I'd be grateful if the Minister could set out the government's approach to negotiations, particularly on the matter of intellectual property waivers, increased local production capacity and conditions on public funding for research. In future international initiatives, we need to follow the letter. And in spirit, does the Minister recognise the importance of an accountability framework to ensure the Accord's success, and will she and her officials be pushing for this in talks? Separately, does she acknowledge the continued importance of action to address the debt crisis in low-income countries, which is clearly diverting resources away from public services and health systems, and what she sees as the UK's role in helping to unlock relief for countries in debt distress and bring creditors to the table? The task of negotiating an effective international treaty on pandemic preparedness will be an historic task. But if we can achieve it, it will save hundreds of thousands of lives in the years to come. It will provide the foundation for a sustained global economic recovery, and it will give us and our partners the freedom and confidence to plan for the future. Labour has a comprehensive plan to strengthen Britain's health security, to end the 13 years of sticking plaster politics under this government and return Britain to the international stage as a trusted development partner. Thank you.
Minister Anne-Marie